Thank you, Farhana. Good afternoon, everybody. Okay. Um, Today, in connection with opioid availability, we are going to discuss sometimes connected with the NDPS Act, that is Narcotic Drugs and Psychotropic Substances Act. So this is an act uh, which governs the opioid use, the control and regulation of opioid substance and psychotropic substances in India. So it's more of control, regulation, all those things coming in NDPS Act. So we are not going to talk about NDPS Act as such, but there are certain terms and certain points which you need to know when you are handling a recognized medical institution. Okay, so I'll be discussing more about those things. So you had 2 or 3 sessions on opioids, and we know that morphine, fentanyl, methadone, all those things they come under NDPS Act. So we need to know what all we should know to comply with certain laws in NDPS Act. So first of all, you need to know what is a recognized medical institution. So you know that a recognized medical institution can purchase, possess, and dispense essential narcotic drugs. And this is a medical institution recognized by the state drug controller for that purpose. So in some state it may be Food and Drug Administration, but in certain states it might be state drug controller. Okay, so recognized medical institution is an institution which can purchase, possess, and dispense essential narcotic drugs, in short ENDs, for medical and scientific purpose. So what is a medical institution? We talked about recognized medical institution, but now we are talking about what is a medical institution, or what all institution can become a medical institution. So it can be a hospital, can be a dispensary, clinic, or an institution. And it either offers services or facilities requiring diagnosis, treatment, or care of illness, disease, injury, deformity, or abnormality. And it is either maintained by government or municipal corporation or municipal council or any person or body of person. So here you have to note that it can be either in the government side or it can be under a person or a body of persons. So both can be called as a medical institution. But all the medical institutions are not recognized medical institution. It becomes recognized medical institution when it possesses, dispense the essential narcotic drugs. That is called as recognized medical institution. So more details about recognized medical institution. So an RMI is it is notified by the state drug controller, and it is called as recognized medical institution. It is not a license or a permit or authorization. Previously, it is called as a license, but now it is RMI status, recognized medical institution status. So we have to apply it to the drug controller if you want to get a recognized medical institution, that is RMI for your institution. You have to apply in the form number 3F. And the drug controller then may or may not provide the status of RMI. If they provide it, they will give it in form number 3G within 60 days. Or if they deny, that also will be informed you within 60 days. And once it is available to you, then the validity is for 3 years. That means every 3 years you have to renew the RMI status. And anytime the state drug controller can cancel or suspend your RMI status if you have done any malpractice. And the most important thing is that government hospitals are deemed to be an RMI. That means they need not apply in the form number 3F to become an RMI. They are deemed to be RMI. But there should be a registered medical practitioner, at least one registered medical practitioner. So government hospitals need not apply for RMI status as they are deemed RMI, but they should have a trained registered medical practitioner. But they have to maintain all the forms which is mentioned as per NDPS Act. So when in an institution there can be many doctors or many registered medical practitioners who has trained in pain and palliative care. So there might be 10 people who are qualified to prescribe ENDs, essential narcotic drugs. In such cases, the institution has to designate one registered medical practitioner as a overall in charge of that RMI. Okay, so that is the designated medical practitioner in charge. And the RMI can dispense the medications or ENDs as per the estimate, or sometimes it will be as per the revised estimate. Sometimes what happens is you have given an estimate, suppose it is 1 kilogram, but in the next 5-6 months you consumed all the 1 kilogram. Then you need not stop prescribing. You can actually buy more ENDs, and you have to provide a revised estimate to the drug controller, and it is in the form number 3J. And if once you get the RMI, then you can procure RMI, procure ENDs and start dispersing it to the patients. And this the details of this, like what is the patient's name, what is the register number of this patient, how many number of morphine or ENDs you have given to the patient. All these are recorded in a form called Form 3X. And when you give these ENDs to a patient, you should get it signed by the patient in the form number 3. So if you are giving morphine to a patient, there is a form number 3E which you need to get it signed by the patient. Which will I will show you the form number 3, but it will contain the patient name, register number, their address, what END you have given to them, how many number has given. All those will be mentioned in the form number 3. And so once you have RMI, you have to maintain this in the 3H, and at the end of an year, you have to give an annual return, which is to be filled in the 3I, and is to be submitted to the drug controller before March 31st. And all the records need to be maintained for 2 years. And drug controller or any other authority designated by the drug controller, they can come at any time and inspect all the records, all the ENDs by this person. So we told that recognized medical institution, if they need to apply, there should be a registered medical practitioner as per NDPS Act. So who is a registered medical practitioner or RMP? So this is a person either registered as per Indian Medical Council Act, or that person can be a dentist who registered under Dentist Act. But this is not the only qualification needed as registered medical practitioner, but they should also undergo training in pain relief and palliative care. So any doctor with MBBS or doctor with or a dentist, if they are registered in the corresponding councils and they have undergone training in pain relief and palliative care, or if they have training in opioid substitution therapy, they can call them as a registered medical practitioner. So even if it is postgraduate or a super specialist, they also have to undergo training in pain relief and palliative care along with their basic qualification. Then only they will become a registered medical practitioner. Then only they can prescribe any ENDs, essential narcotic drugs. So what are essential narcotic drugs? So these are the narcotic drugs which are notified by the Drug Controller General of India. So as of now, there are 6 essential narcotic drugs: morphine, methadone, codeine, fentanyl, hydrocodone, and oxycodone. And can anybody tell me which are the opioids which are not available in India as of now? Out of these ENDs, which I have shown here, which are not available in India?
Participants, kindly post in the chat box, or even you can unmute and answer.
Yeah, that's right, Dr. Bindu. So hydrocodone and oxycodone are not available in India, whereas the other 4 medications, narcotic drugs, are available. Morphine, methadone, fentanyl, and codeine are available. And this can be changed by the Drug Controller General of India. Okay, if any other opioids which they think, okay, this can come under essential narcotic drugs. So the Controller General of India can just notify it and make it a essential narcotic drug. So now, who all can possess essential narcotic drugs? So there are many people who can possess essential narcotic drugs. It can be by the patient for their own use, and the registered medical practitioner. Registered medical practitioner, suppose if you want to individually keep uh, essential narcotic drugs, there is a provision for that. But the quantity of ENDs that you can possess is very less, and this ENDs that need to be administered under your supervision for emergency purpose. It is not for selling. It is for emergency purpose. Okay. And then any person authorized by state drug controller, then recognized medical institution can possess ENDs. Manufacturer, licensed dealer or chemist, education or scientific institute authorized by state drug controller, pilot or captain of aircraft or ship, then person in charge of ambulance for emergency use. So there are, what you have to understand is, there are many people who can possess ENDs, but most of that need approval from the state drug controller, except patient, which is prescribed by the registered medical practice. So what are the prerequisites? Or when you prescribe ENTs, what all should you keep in your mind? Can anybody tell me what all should you be careful while you prescribe ENTs? Double prescription. Anybody else?
So Dr. Darshana had messaged me overdosage. Overdosage.
Overdosage. Okay. Anything else? Okay. So as per NDPS Act, you should write it with the date. So the name of the ENTs should write with the date of prescription. Then your name, who is the registered medical practitioner, your name, your address, your registration number with the local medical council, your signature, name and address of the patient. Then what is the strength of ENT you are prescribing? What is the period for which you are giving the CND and how much are you giving? Suppose you are prescribing morphine 10 mg 4 hourly. 10 mg is the daily dose, 10 mg 4 hourly is the daily dose. And the period of consumption, it might be for 1 week. So for 1 week, how many tablets are necessary? You are prescribing morphine 10 mg 4 hourly. How many tablets would you give for 1 week? Potato. Okay. But you also prescribe SOS doses, isn't it? So it is not a tab morphine 10 milligram Q4H. It is tab morphine 10 milligram Q4H and SOS. So if you are not going to provide SOS dose, it would be 42. But if you also want to provide SOS dose, that's the correct prescription. Then you need to provide more, isn't it? So it might be something like 50 or 60. Huh? So all this information should be there. I will show you what all should be there. So this is how you have to prescribe. The name, age and address of the patient. What is the END you are prescribing? So it is tablet morphine. So it should be in capital letters. So it is not according to NDPS Act, but we know that it is as per NMC. We have to prescribe medication in capital letters. So tab morphine. What is the dose? It is 10 milligram, half Q for H and half SOS. It is for a duration of 10 days. And how many are you providing? 30 numbers. Okay. And your signature, name, medical council registration number, and address. So all these should be there according to NDPS Act. So what are the prerequisites for an institution to become an RMI, registered medical institution? Anybody knows what all should be there for an institution to become RMI? So the institution should have a medical officer in charge or overall in charge of that recognized medical institution. So we call it as registered medical practitioner. Then so we know that registered medical practitioner, according to NDPS Act, we already defined the person either should be an MBBS doctor or a dentist with training in pain relief and palliative care, or they have training in opioid substitution therapy. So that person is the qualified person. Then there should be facility for safely storing ENDs, a double locking system to keep the ENDs safe. And there should be basic infrastructure facilities. That means there should be enough number of beds, enough space for the patients to come and sit, and the staff, if they want to provide ENDs, there should be enough space. And there should be enough facility for keeping the registers, which need to be maintained when you prescribe ENDs. So basically, even though we have noted down 6 things, basically what it includes is there should be registered medical practitioner, then we should have safe locking capacity and enough infrastructure, including furniture, chairs, space, etc. Then records. So these are the things which we need to apply for an RMI. So if RMI is available to you, many people will ask, do we need to get RMI separately for OP, another one for inpatient unit, and if we are doing home care, do we need another RMI? So basically, we need only one RMI status, and that can be used for all the purpose: outpatient unit, inpatient unit, and home care. So this is as per the NDPS Act. The ENDs which or RMI status which you got, they can also provide ENDs for home care treatment. So the conditions are the patient should be registered with the RMI. So when we provide ENDs, all those patients would be registered with RMI. Then that registered medical practitioner or overall in charge of the RMI can nominate somebody from your team to carry the essential quantity of ENDs to the patient for home care treatment. And this need to be provided at the patient's home or at the place of stay. Okay. So with one RMI, you can use it for home care treatment or outpatient department or inpatient unit. So all the 3 is covered under RMI. So now we'll move on to the process of acquiring or getting an RMI. So what all should we do to get an RMI status? So first of all, there should be a person who is trained in pain relief and palliative care, who is an MBBS or dentist. And once this person is available, you can apply for RMI status. Then the drug controller will allot sometime the controller itself, or he may designate somebody else to inspect your institution. And if he is satisfied with the conditions which we already described, then he may give a recommendation to the drug controller saying, okay, this institution is apt to provide RMI. Then you will get authorization as RMI. Once it is available, you can purchase ENDs from the dealer or from whoever is available in your state. And once this is purchased, there will be something called consignment note, and the dealer will be sending the ENDs along with consignment note, and then you will enter it in the register as stock, and then you start dispensing. And you have to keep all the forms which we have described earlier, and you have to file annual return by before 31st March. And also you have to give annual estimate every year. And you have to renew the RMI status every 3 years. Okay, we will go into the details now. So first of all, we should have a doctor, either a person with MBBS or a dentist, who need to be trained in pain relief and palliative care or oral substitution therapy. The next step is applying to the state drug controller or Food and Drug Administration department. So there is a form called form number 3F to send application. So you have to fill the form number 3F, and this would include many information, including who is the registered medical practitioner, and you have to keep a copy of the degree certificate of the doctor, registration with the local medical council, and also what training has he taken in pain relief and palliative care or oral substitution therapy. This, I can say a question here, this FCPM course is useful for morphine prescription, right? Yes, that's right. You can apply for RMI status, or your institution can apply for RMI status once you get the certificate of FCPM. So that is the training certificate. Okay. And so you will send the field 3 form number 3F along with form number 3J. So when you apply to the drug controller, you have to tell him how many or how much quantity of essential narcotic drugs you need. You can specify, I need this much quantity of morphine, I need this much quantity of methadone, this much fentanyl. And you also need to write from where you will purchase these medications. So that is known as form 3J. If you are going to start the RMI, or this is the first time you are using, you are applying to get an RMI, then maybe 500 gram of morphine as an initial step. That would be the annual estimation. But if you are having a lot of patients who need opioids, then you have to apply for the annual estimate would be more than 500 grams. And then you should have a covering letter. Why you are applying for RMI status? What is the need? And it should also include a self-addressed stamped envelope in which the drug controller would send you the RMI status in the form number 3G. So you can say this is the form number 3F in which you have to apply for RMI status. So the heading you can say it is the application for issue or renewal of certificate of recognition as recognized medical institution. So there are a lot of information they are asking, and you can see the item number 5, name of the qualified medical practitioner who would be in charge of essential narcotic drugs. Okay, and this is the form number 3J which you have to enclose along with 3F. So this is the estimate of annual requirement for essential narcotic drugs. So you can see the lower the table on the lower side, which asks about name of the essential narcotic drugs. What is the quantity dispersed during the previous year? That would be 0 if you are applying for the first time. What is the estimated annual requirement? So if it is smoking and if you are applying for the first time, 500 gram would be enough. But if you have a large number of patients, uh, probably if you are looking at large number of cancer patients, then you might require more than 500 grams. And there is also provision, you can say revised estimated annual requirement and reason for revision. Uh, if you have applied for 500 grams and then, by June, July, you have used all the 500 grams, then you need not stop procuring ENDs. You can procure END, but you should give a revised annual estimate before November 31st. And you can also state the reason why you needed more quantity. Maybe you can say we have a large number of patients. And once you apply it to the drug controller, then next step would be inspection. So the either drug controller himself or the person designated by him would come to your hospital, clinic, or whatever it may be, and then this person will look into all those aspects. Are there a designated medical practitioner, that is registered medical practitioner? Is there enough infrastructure? Is there enough? Is there a safe locking capacity? Are there safe places to keep registers? Once it is satisfied, he will give a recommendation to the drug controller and he will give you the RMI status in the form number 3G. And they have to give it in 60 days. So he may either give the RMI or he may reject, but he need to state the reason why it was rejected. That also should be given within 60 days. So this is the certificate of recognition. This is the form number 3G. This is the RMI status. And once you get the RMI status, then you can order for purchase of PNDs. So you can fill the annexer for along with RMI certificate and send it to the dealer or pharmaceutical agency from which you are going to purchase END. And then they will give you the ENDs along with a consignment note. So I will show you what all that is. So there will be 3 consignment notes. One is in white and the other 2 will be yellow and pink. So the white is returned by you and the others are signed and returned back to the supplier. So this is the annexure for in which you can order the ENDs. So the name and address of your RMI, description of the quantity for which order is placed. So there are some details which you have to provide. And once this END is available with you, then you have to dispense it to the patients. And while you dispense, you need to get this form filled by the patient. You can see this is form number 3E. And you can see the name of the patient, what is the postal address, brief description of illness, what essential narcotic drugs are you dispensing, and the date, name of the essential narcotic drugs you have given to the patient, how many numbers you have given, and you should get the signature or thumb impression of the patient. So this form need to be maintained, and whenever you give the essential narcotic drug to the patient. So this is the form which called 3H, which you need to maintain as an in a recognized medical institution, which will show that which all patients you have given the RMI, ENDs, how many numbers of ENDs has been given. There should be an opening balance. You can see this is on this side. What is the opening balance? And you can see the date, opening balance, what is the name of the patient, medical record number of the patient, which is the batch of the END. This is for morphine, which is the batch of END you have given to the patient, how many quantity you have dispersed, what is the closing stock, and then the registered medical practitioner or overall in charge of the RMI status has to sign this every day. And you can see if you are receiving ENDs, that has to be entered here. Date, from which manufacturer are you getting this END? What is the batch number? What is the expiry? How many quantities you have received? So you can see for easy identification, you can use a reading so that we can see whoever is looking at this record, they can easily understand that, okay, this is the END they have received. So all these records connected with RMI status need to be maintained for 2 years from the date of last entry. So if your last entry in the register is today, 22nd of July, then you have to retain this register till 22nd of July 2026. And we already talked about form number 3H, in which the daily amount of ENDs given to the patient need to be maintained, and form number 3E, in which you have to get the patient's signature, and annual estimate need to be annual return need to be given to the drug controller before 31st March. So if you are using opioid this year, then the annual return should be done in the before 31st March of 2025. So from January 1st January 2024 to 31st December 2024, you have to see how many quantity of END you have dispensed. So all those would come in form number 3I when you file it in before 31st March 2025. So in addition to an institution that is RMI holding opioids, in the individual status, you can also hold a small amount of ENDs. So the as an individual, there is a limitation for the ENDs that you can hold with you. So morphine, it should be less than 500 milligrams. Fentanyl packs, not more than 2 transdermal fentanyl patch of 12.5 microgram each. And codeine not more than 2000 milligram. So that means 50 numbers of 10 milligram morphine. That's the maximum amount that you can keep as an individual capacity. But if you think, okay, I need more than this, then you need to apply separately to the drug controller, and they will provide special permission in the form number 3B. And if you have ENTs with you, and there is another institution where your friend is working, and he is also trained in palliative care, but there is no RMI. And this person is asking you, hello, can you give us 1,000 numbers of morphine tablet? It should not be done. Uh, you can do it only with the permission of state drug controller. Okay. And if there are any expired ENDs, suppose the expiry date is 22nd July 2024, and you have 1,500 10 milligram morphine tablets are remaining with you. Next day, you should not dispose it. You should uh, write to the drug controller saying that we have some of the morphine tablets which have expired, and kindly do the needful for disposing these ENDs. So the drug controller will depute a designated person to come to your institution, and they will destroy it in your presence. Okay. And if suppose you have provided some ENDs, suppose morphine 10 milligram is provided to one of the patient. Uh, you have given 500 numbers, but the patient used only 100 and he died after that. And this patient's caregiver is bringing the 400 numbers of morphine to you. Can you take it back? What do you think? You can take it back and you have to enter it as in the receipt. Okay. So you have to add it in your stock. So the annual estimate is submitted in the form number 3J before November 30th. And I told you, if you have used more than the annual estimate, then you can submit a revised estimate before August 31st. So I think that's all I wanted to speak about some terms and clauses related to the NDPS Act. So for more clarity, just want to tell you the forms which we have described. Form number 3B is the special authorization for registered medical practitioners to keep more ENDs. I told you that a small amount of ENDs can be kept by the RMP, but if they require more, this will be provided or authorized by the state drug controller in the form number 3B. And form number 3 is the consignment note. Form number 3D is the where if you are the registered medical practitioner keeping this small amount of ENDs, you have to use that form number 3D. And form number 3E, in which you have to get the patient signature when you dispense the ENDs. And form number 3F is the form in which you have to apply or renew one for RMI. 3G is the form for recognition as RMI, which is given by the drug controller. Form number 3H is the daily accounts. So in which you will enter each and every patient for whom you have given END and what all you have received. That all need to be entered in the form number 3H. 3I is the form in which you will submit the annual return, and form number 3J is the form in which you will provide annual estimate to the drug controller. So next, Shalini would be talking to you.
Hi, good afternoon, everyone. Can everybody hear me, right? Okay, great. So, as already introduced, my name is Shalini and I head the facilitation division of Pallium India. Our team basically works with individuals like you in different states who want to procure this certificate that Dr. Sunil has just beautifully explained how you can procure it. I also have Ms. Sunanda Samal with me right now in the team who's particularly taking care of Goa state. So anybody who wants to acquire this certificate, the person can reach out to Sunanda after the session. Now, what am I going to talk to you today? I'm going to talk to you today more like an appeal to each one of you. So if you see, I see that in today's group, there are 46 participants from Goa, and then there are a couple of them from West Bengal, Kerala, one from Andaman Nicobar. And I would really want to know who's from Andaman Nicobar because we're trying to reach out to people there to see whether palliative care is existing or not and how we can have morphine available in the islands. We have a couple of them from Maharashtra, two from Karnataka, one Haryana, and one each from Assam and Jammu and Kashmir. So to all of you, my session is going to be more of an appeal to start practicing palliative care, to start seeing palliative care patients, and to start prescribing morphine, oral morphine wherever is needed. I would really request all of you to go, if all of you can access, you're sitting in front of your laptops, I would really want you to access our website directory. If you can put the link for our directory in the chat box. The moment you will open the directory, you will realize that there are very few centers in other states, very few palliative care centers in other states in comparison to what it is there in Kerala. So Dr. Farhana is going to put the link. Meanwhile, I'll just share my screen and start my presentation. So if you'll see right now, in most of the states, there are only, so I know of Goa, in Goa only 13 palliative care centers are there. It's just a very, very small state in comparison to the other states. But if you'll go to states like in Northeast, hardly 2 or 3 or 4, 5 centers. So again, coming back to this appeal that I would request each of you to create as many palliative care centers as possible. If you can create and encourage your colleagues, your friends also to create those palliative care centers or units where patients can come. Why? Because if you see the screen, there are more than 7 million Indians who are in serious health-related suffering in India. And the pain relief is reaching only less than 4% of the needy. It is as per the Lancet Commission report of 2017. You will see only in India, only 4% people are able to receive pain relief. That means only 4% people are able to access oral morphine. And not just this much, a lot of times a state has a center where oral morphine is available, but it is available only in one city. So let's take an example of Madhya Pradesh, a state like Madhya Pradesh. Oral morphine is only available in Bhopal or Indore. What happens to people who are actually patients spread across in such a big state? So that's why our advocacy is that we will be encouraging people to open up palliative care centers and would be encouraging people to procure oral morphine for their patients' pain relief. If you see at this slide, this is basically telling you how morphine is distributed across the world. I would not want you to get too bogged down with the details on the slide. It's a very busy slide. You just focus on the percentage. So as a doctor, you have the responsibility first to ensure that the patients have pain relief medicines, but at the same time also ensure that these pain relief medicines, which are also prone to be misused or pilfered by people who just want to use it for their high or getting a high, you have to create a balance between both of them. Then only it will be justified, then only this legal laws will turn into the patient's favor. So if you see this slide, in India, only 4% people are receiving pain relief. In China, 16%. In Russia, 8%. But comparison to this, see Canada and US. There are 3,090% are receiving. So that means it is an overdose. So because of the pharmaceutical industry really encouraging fentanyl, expensive medicines like fentanyl patches and all, they are requesting the medical fraternity to order more and more of these essential narcotic drugs. And that's why it is going completely to the other side, other pendulums, other side where it is getting misused. Wherever pain relief is not needed also, the doctors are still prescribing. So of course, in India, we don't want to go the Canada and the USA way, but we definitely want to reach to 100%, like probably Argentina, where it is already 115% patients are getting pain relief, or in Chile, where 114% are getting pain relief. So that is why this slide is very important, that where we are in terms of palliative care and pain relief. It's also in United Nations Single Convention in 1961, they clearly said that the medical use of narcotic drugs continues to be indispensable for the relief of pain and suffering. That means that narcotic drugs, particularly these essential narcotic drugs, have to be available for every patient. It has come for as a rule for every country to implement. Adequate provision must be made to ensure the availability of narcotic drugs for such purposes. And because of this reason, we, Pallium India, along with our team and all of our advocates, we are talking about each of the doctors, medical institutes to procure oral morphine, which is very, very inexpensive pain relief for any patient, from a poor patient to a rich person also. So how do we advocate about this oral morphine? As per WHO Palliative Care Advocacy Triangle, of course, you are getting the education about it. You see, at one side is the education where you are getting all this training. You have already got the training. Somebody asked a question in the chat that is this course makes you eligible to apply for an RMI certificate for your institute, or does it make you eligible to get an RMP certificate? The answer is yes, as Dr. Sunil also mentioned. So next comes is drug availability. You have already got yourself trained, but do you have the drugs available in your hospital or in the clinic where you are practicing palliative care? So this is where our team will come into being. Like Sananda, there are other 6 regional facilitators spread around India. I'll show you where all they are sitting, and I'll request Dr. Farhana to put the numbers of each regional facilitator in the chat box, so that you can see whom you can contact to really fill the form that Dr. Sunil beautifully explained, each form, how to fill it, what signatures to get, and to coordinate between the drug controllers of those states. So we will provide that kind of support to you. And of course, if you can inculcate a policy for your institute, a policy of palliative care for your state, if you can advocate for that, that will be the ideal thing that you want to achieve. So I'm coming back to that directory. I hope all of you have got into the Pallium India directory and seen for your states how many palliative care centers are available. So here is a little summary that 60% of all palliative care centers are in Kerala. Kerala, every district has at least 10 to 15 palliative care centers. Like even when we are working on the directory, we go mad. For Kerala, we have to assign one whole person and the other people do it for rest of the states. If you yourself see Daman Island and Andaman and Nicobar Islands, we have no clue whether palliative care services are there or not. So I would really request the doctor who's from Andaman Nicobar to raise your hand, because I'm going to get in touch with you right away and going to ask you if we can have palliative care services available. Because a lot of times we get references from other centers, other doctors, and they want to send a patient to Andaman, but they don't know whether they can refer to a patient there, they can refer to a doctor there or not. So we would request whosoever is the Andaman doctor, please. Alma Shamil. Is she logged in? No, never mind. We'll check on, probably I'll catch up with her later. And and the 28 states and 6 union territories that we have mentioned, somewhere the palliative care is available, somewhere palliative care is far off. Like I took the example of MP, the oral morphine is available in Bhopal or Indore. And I personally visited the biggest hospital in Indore is not procuring oral morphine. They are prescribing oral morphine and they are sending the patient to another place called Dawa Bazaar. Now that is Dawa Bazaar, a patient, he's coming at one place to meet the doctor and then he's going to a far off place to get the medicines, which is not right. When even when you're having a headache, you don't want to move from one room to the other room. How we are expecting a patient to travel such long distance to just procure a medicine. So that's the appeal, that please procure medicines where you are prescribing it or where you are seeing the patients. As I already mentioned, Kerala has around 600 recognized medical institutions which stock and dispense essential narcotic drugs. That's why pain relief is much, much easily available in Kerala state than any other state. We have low-cost oral morphine available. There is safe access to oral morphine, like there is 16 times national average. Like it is more than 16 times for the rest of India that we have morphine available in Kerala. But still we are lagging far behind and we need to improve on. As I already mentioned, there has to be a principle of balance. Each of you, each of us have this dual responsibility to prevent inappropriate and non-medical use of opioids. We have to be very careful that the entire documentation that Dr. Sunil explained to you has to be maintained thoroughly. You have to keep a check on which patient needs to be given what and whether the medicines are being utilized or not, so that you're ensuring access to opioids for people in pain, but you're also ensuring that misuse is not happening. So there has to be a proper balance. For public health, we really need a proper balance. Look at this slide of whole of India. You'll quickly see that in 31 states and union territories, they have started issuing RMIs. The RMI process that Dr. Sunil explained, the 31 states and union territories marked in green, they are issuing RMIs. So it is not that, and I think that covers everyone who's there here. So particularly Goa, Dr. Jyotika Sardesai, no, I don't think she's a doctor. Jyotika Sardesai is issuing RMI. People from Goa, Dilasa Palliative Care Center has an RMI. Shanti Avedana Southern has an RMI. So you can also procure RMI with the right application to the drug controller. If you need any help, of course, Sunanda is there to help you out. The 3 states that are yet to issue RMIs are Meghalaya, Manipur, and Tripura. Our team is still trying to work through them, working with the drug controller. We have a regional facilitator like Sunanda. He's working out of Guwahati. His name is Rontu. And he is working with the state drug controller departments of these 3 states to ensure that they start issuing RMIs ASAP. Of course, the Andaman Nicobar Island and Daman and Dadar Islands, we have no clue what's happening there, where the patients are going, what medicines they are getting from where. So this is a quick look at our work. We are still working, Parliament is working in these yellow states to still reach out to people because we are trying to conduct an opioid availability workshop. What we do is we bring the medical fraternity, the state drug controller, and the institutes, different institutes, bring on one platform, either in person or virtually, and conduct this workshop where you can ask all your questions. Because state is a health subject, health is a state subject. So every state has its individual problems in issuing RMIs. I'm going to get into the detail of some of the barriers that every state drug controller department has come up with, and they ask certain questions or request for certain documents, which is not as per the legal requirement. Before we move on, this is the quick look at the team. Dr. Farhana has already shared in the chat box the names. I work out of Trivandrum. We have 2 people working out of Chennai who take care of the south. We have Sunanda working out of Pune. Rontu in Guwahati, then we have one Syed in Delhi, and Dehradun we have Rajender, and Chandigarh we have Jatin. So they have already been mentioned in the chat box. Please reach out to them if you need any help in procuring the RMI certificate. Now, I'm going to refer to some of the barriers that we have faced while working with the state drug controllers. Every state, in a way to have a control, the state drug controllers, a lot of times, they try to put extra restrictions which are not as per this rule that Dr. Sunil just explained. So whatever Dr. Sunil has explained, it has been taken from this gazetted document, which is issued in 2015, and the stage is that it's been 9 years now, and we are still struggling to implement in so many states. So, but we'll keep working, and with your support, we will ensure that all these states have the RMIs and have the pain relief for the patients. So one of the big barriers, unnecessary documents required with application. A lot of state drug controllers might ask you, give us affidavits from trustees or directors of your institute. Some will say, okay, give us the trust deed. Some will say, give us the constitution of the state, or give us the floor plan of the institute. So all these are unnecessary documents. You just have to be very assertive in telling them that we know, we have been taught, you have learned this in this course, that for applying for an RMI, you only need certain things which Dr. Sunil has already explained to you. Nothing extra you need to submit. And I would say, if you do not want to get into a conflict with your state drug controller, please invite us. We will fight on your behalf. Our regional facilitator will go and advocate for your RMIs, and they will help you get one. So what is the right thing? As Dr. Sunil has already talked to you about this, a covering letter, a 3F form, application form, a completed 3J form, and the name of the doctor in charge with all his certificates. And some of them will say, no, if you have an OPD, then for an IPD, you will have to have a different certificate. Some will say, if you have IPD, you have to have a different certificate for home care. But as Dr. Sunil also mentioned, I'm referring to this document. If you want to read this document, I'm sure the training team will share with you this entire gusted document after the session. You can read through this paragraph, which clearly says for home care treatment, you don't need any additional certificate. It's the same RFMI certificate you can use to take morphine to the homes of your patient. Then there is another barrier. Some state drug controllers say that injectables need separate license or certificate. No. All these 6 essential narcotic drugs, any formulation, you can procure from this RMI certificate only. For other medicines beyond these 6, you might need different certificates, different licenses like NDPS 2 or NDPS 5. But for these 6, this RMI is sufficient. And here I want to talk about one thing. A lot of hospitals are already procuring this for their ICUs, injectable form of morphine or fentanyl, but they do not have this certificate of RMI, which is illegal now. So I would really suggest that each of you should go back and check that whether you have the RMI 3G certificate in your institutes or not. Again, in the same document, there is a whole table confirming all the formulations. So you can refer to this document when you go and apply for an RMI. There are a lot of barriers in the minds of the medical fraternity also. A lot of times, people like you and the institutes, they have come to us, they have said that we can prescribe any doctor can prescribe essential narcotic drugs, which is not right as per the legal document. If you see the legal document, it clearly says the doctor, MBBS or BDS, who is already trained in pain relief and palliative care. So oncologists or anesthesiologists, though they might have referred to palliation in their MD degrees, but they still need to have a palliative care degree or a pain relief degree for prescribing these essential narcotic drugs. You can read through this chapter 5 this whole government document, you will be able to understand in detail yourself. I know legal language would be a little difficult. We have kind of rammed it up completely in our heads, but we would really suggest that for your own conviction, go and read these documents when the team shares with you. There's also reluctance from the part of authorities to procure. Why? Because they fear the punishment. What if misuse happens? See, you can see in Kerala state, there are 600 RMIs. There's hardly any misuse reported. We are not saying that misuse has not happened. Across India, there are some 40, 45 cases reported of misuse. But you see, in the last 10 years, 9 to 10 years, if only 45 cases have been reported, that also because of, not because of the mistake from the doctor or the institute, but because of not unknowing the real rules. And that's what has created. That's why we are creating this awareness. So please do not be scared of the punishment, but be more pro towards procuring these opioids for the patients. Fear of annoying officials. I would like to share this example with you. In one of the union territories, we went and helped an institute procure an RMI, but till then they were going to the excise department to get the morphine every time. And then when we procured the RMI for them and we told them, now you can just simply place the order to the vendor. You don't have to go to excise. You don't have to go to any other department. You simply place your order. They were so scared. They said, shall we go to the excise department and tell them that we will not be coming to them anymore? Which was like, it was a sheer fear and fear of not annoying the excise officials. So a lot of times excise themselves doesn't know that they don't have to play a role here. So that is the kind of advocacy we need. So here is where we can help you. I know you all doctors have to look after your primary responsibility is patients. So me and my team are here to help you with doing all this work around. Reluctance to take responsibility. Some people don't want to take the responsibility because they don't want to maintain the documentation. To be honest, none of you have to maintain the documentation yourself. You can assign a nurse, you can assign your pharmacist, you can assign a data manager to maintain the documentation, but the accountability only lies with you. So out here also in our center, either Dr. Sunil, earlier Dr. M.R. Rajgopal used to sign, but it was maintained by somebody else. But now Dr. Sunil signs on our all these certificates, but it is maintained by our pharmacy. So you don't have to personally get involved, but put a trusted person who can manage these accounts for you. And there is another thing. Lot of drug controllers say that you need to have a pharmacy license to procure it. You need to have a pharmacy license to dispense medicines which are not essential narcotic drugs. If you are only procuring essential narcotic drugs, then you do not need a pharmacy license. But if you need any other medicines and you want to run a pharmacy in your center, then of course you will have to have a pharmacy license. So these are few myths and fears that I wanted to share. There's another document that training team will share with you. This document is by National Cancer Grid, which is a group of all cancer hospital and oncologists. They have issued these guidelines for stocking and dispensing essential narcotic drugs in medical institutes. It talks about entire process that Dr. Sunil mentioned. It in very simple ways. You don't have to go through the government document, but this document is very simple to read and you can refer to it for procuring those medicines. I would like to end here. That's a couple of books by Dr. Rajgopal. You will talk, if you really want to know the history of opioids, how 19 years of fight by palliative care physicians and colleagues ultimately changed the law of 1985 to 2015 and made these medicines available for medical use. So these people have really run from pillar to post to make an amendment to this act. And if you want to read about it, you can go through this. So you can buy a copy of Sir's book and you can read through it, how he has explained his struggle in changing the amendment, bringing the amendment. So a last request to you, please, from your side, start procuring oral morphine wherever you are practicing. and start helping the patient in need. Thank you so much.
Thank you, Shalini ma'am, for that wonderful presentation, and thank you, Sunil sir, for the same. And right now we have a poll. We have about 15 questions. So Gayatri will be launching the poll. So you can give your answers for those questions, and based on that, the discussion will happen. So yes, Gayatri.
So you have to choose the correct answer, and at the end you can submit. This will not be used for any assessment. This is just for us to understand what you have retained from this session.
So for the poll one, you have 5 questions. So you can answer all the 5 questions. Once answered, you can end the poll. So I request all the participants to answer this poll.
There are about 40 participants, and only 12 has completed now.
Only 13 people have answered till now. I request all others to submit your answers for these questions.
I can see there are some requests in the chat. Some people have not got the link. So you can try now.
So we have relaunched the poll once again. For those who have not answered, please use this opportunity and mark your answers for these questions. Because we have received many requests that poll screen suddenly disappeared. So we have relaunched it once again. Please make use of this opportunity. So the thing is, it will end in 1 minute because within 1 to 2 minutes it ends. So please be quick. It is something which is automatic, so it ends all of a sudden. So we have launched it once again. Make use of the opportunity and answer it soon.
So please do it fast. Only 23 of you have completed. I think we can end the poll. So we will end the poll now. Okay, let's see the answers.
Share results.
Okay, so the first question was, I can prescribe oral morphine if I am a super specialty doctor without any training in pain relief and palliative care. And I can see 18 people, 18 doctors has responded false. And four of you have responded yes, true. But the answer is false. Even if you are super specialist or specialist or MBBS doctor, as per NDPS Act, you also need to have training in pain relief and palliative care, or you should have training in oral substitution therapy to prescribe ENTs. So the answer to the first question is false. Which of the following is not an essential narcotic drug? So there are 6 essential narcotic drugs, and yeah, most of you got it correct. Buprenorphine is the right answer. That is not an essential narcotic drug. Morphine, methadone, codeine, fentanyl, all those are essential narcotic drugs. What is an RMI? RMI is a recognized medical institution. It is not a registered medical institution, it is a recognized medical institution. That is the status by which you can acquire, dispense the ENTs. Authorization for RMI is a period of for 3 years. Okay, so it is for 3 years, and you have to renew it after 3 years.
Dr. Sunil, if you'll allow me, I'll just add one thing here. One of the incidents that happened as per the legal documents also, maximum of 3 years validity is possible, but a lot of state drug controllers might say that we will issue only for 1 year. We always encourage them to issue for 3 years, but they do have a right to issue only for 1 year, because in the legal document, the language goes that they can issue up to 3 years. So I would suggest, if you're getting an RMI, get it for 1 year at least to begin with, and then we can work with you, or you can work with the drug controller office and show the work that you're doing. They will start issuing it for 3 years to you. I just wanted to add as an exception because we face this challenge in one of the states. Please go ahead.
What is the next question?
So the
Okay.
first question is, who can be
Who
the
can be the officer in charge of an RMI? Any person registered as medical practitioner under the
Indian Medical Council Act
uh,
1956. Option 2 is or any person registered as dentist under the Dentist Act of 1948. That is option 1. Option B is and undergone training along with A and B in the medical use of ENDs. Option 3 is both A and B is a must, and option 4 is not sure.
Okay. So the right answer is both A and B is a must, isn't it? So the medical officer in charge of an RMI should be either a person has MBBS or who is a dentist, and they should also undergo training in pain relief and palliative care, or has training in oral substitution therapy. So the both A and B is a must. So in the meantime, if you have any questions, you can type it in the chat box. We will have another set of polls now.
Right, please.
Okay, now there will be another 5 questions. You can start doing it now. Only 7 of you have completed.
Is the poll is visible to anyone, all of you?
We can see 19 people have answered right now. So if you close that window, it will go off, and in your mobile on the top, there will be 3 lines there. So you can click on that and the poll will reappear in case if you have closed it. So Dr. Shruti had mentioned that she cannot see the poll questions, but everyone is answering. Dr. Shruti, please check if you're working on your mean, like you're attending from mobile or laptop, I'm not sure. But the 3 lines will be there, and even if you have logged in from laptop, it will be there below.
Start it now.
We are ending the poll.
Okay, so for the first question is, which of the following is a prerequisite for an RMI? So there should be safe double locking cupboard, officer in charge of RMI trained in medical use of ENDs, basic infrastructure and facilities, 1 person mandated record keeping, all of the above. So actually we should have all of the above according to NDPS Act. Next is, when should an RMI submit annual return form? It is before 31st March of every year. Okay. Most of you got it right. The third is expired stock of ENTs can be destroyed by officer in charge of an RMI. No, it cannot be done. Should not be done. Actually, you have to send a letter to the state controller stating that you have this much quantity of expired ENTs and ask them to come and dispose this medication. So it should be done only in presence of the person designated by the state drug controller. The medical officer in charge should not dispose. It also following form is to be filled to apply as an RMI. It is 3F. Okay. 3G is the form in which the drug controller would provide you with RMI. So it is the 3F. Within how many days does the drug controller reply to your application? It is within 60 days. So either he can reject or he can approve. But whatever be the result, it should be informed within 60 days.
We have one more poll, which is the last poll. That will be for another 5 questions. So Gayatri, please launch the.
Okay, you can start doing it now.
We have ended the poll.
Okay. So the first one is record of every patient to whom ENDs was dispensed is maintained in the format of form. Can anybody tell us which form need to be used for the first question?
Participants, you can unmute and speak.
Okay. I can see somebody has responded, Dr. Lorna Fernandez. If you look at this question carefully, here it talks about the records of every patient. That means if you need to see the record of every patient, that should be form number 3H, which the option which is not given here. Okay, but if it is asked whether individual patients for whom END was dispensed is maintained in the format. It is in the form number 3. Individual patients format is 3, whereas for every patient you have to see it is in the form number 3H. So it is the form number 3E in which we have to get the patient's signature. So here for the first question there is no correct answer here. Second question, all records of ENDs dispensed with day-to-day account of each transaction in ENDs are kept for a period of 2 years from the date of last entry. Okay. If the requirement for END has increased during the course of the year, the officer in charge of RMI can submit revised estimate for the same year by it is 30th August. Next one is any individual registered medical practitioner may hold a small stock of END. That is true. But you have to apply for it to the drug controller. Next is fifth question. When should an RMI submit an annual estimate every year? Annual estimate, it is by, okay, I can see there is no correct answer here. It is before 31st March. Okay, before 31st March. Okay. Okay, so if you have any doubts about this, anything, you can ask now.
So we have few questions which have been already posted in the Google form. So I can read that for you. There was a question from Dr. Dilip. So if we have one central office, is there a process to get one central license?
No. So if suppose you have many institutions and there is a headquarters, then probably you can, if your central or headquarters has an RMI status, you can use that RMI status for the patients who are registered with that headquarters. You would not be able to distribute it to your other institution.
I think that's probably, as you mentioned, but we just want to repeat it. I think most of you are government doctors working in government institutes. So we would like to highlight that the government institutes do not need to apply for RMI certificate. In government institute, you generally indent your essential narcotic drugs through the internal drug supply chain. Every state has its own drug supply chain, and then you you indent from them. Unless you are a private institute or a charitable or any Section 8 company or an NGO, then you have to apply for an RMI certificate. As a government institute, you do not have to apply for RMI certificate. You have to do internal indenting only. However, if your internal indent by any chance, because that's what we have seen a lot of times, the medicines are not available in the internal stores, where your central procurement happens, then each institute, like suppose there is a medical college, they want to have it for their institute, they can procure from a direct vendor and maintain their registers and inform the drug controller. Then you don't have to go through your internal supply chain. So I just wanted to highlight this for the government centers. But for non-government centers, and as Dr. Sunil mentioned, one unit can have an RMI certificate only for that particular location. For each location, you have to have a separate RMI certificate from the state drug controller of that state.
Sorry, I can see that are some questions.
Sir,
Yes, sir.
so there was a question from Dr. Bindu. Is there any link from which we can get contact numbers for all the palliative care centers in districts of Kerala? Yes, I have shared the link of the directory in the WhatsApp group as well as in this Zoom chat. So when you click on that, all the states will be there. So you have to click on Kerala, and from there, all the centers will be available.
So Pallium India maintains a directory of palliative care institution across India. So you just visit the Pallium India website and you can see the directory. Just click on that and then you will get all the institutions where morphine is available and what all services are available there.
So there's one more question, sir, and Shalini ma'am. So if we want to start a private palliative care clinic, so will the drug controller issue a license for a small clinic?
Yeah. So if you register as a clinic, you can apply for RMI, and if you satisfy all the requirements for an RMI, then they should provide you with RMI.
Just an additional caution, we will suggest that have that clinic registered under the Clinical Establishment Act. If you are saying, so this is another example happened where the home care team, there was a home care organization who wanted to take RMI in the name of a flat where they were just coming together and distributing the medicines, which was not allowed because that particular institute has to be a clinical establishment. So ensure that whichever small clinic, whether it's a one-room clinic or in one-room OPD or something, but it is registered under the Clinical Establishment Act. So then you can apply for the RMI under that act.
Thank you, Shalini ma'am. So there's one more question. Do we have, Dr. Dilip has posted that they have one hospital in Mumbai which has its own pharmacy. And can they get opioid license for that pharmacy?
So whether it is pharmacy or not, that is not the thing which we need. You need not have pharmacy license to get RMI status. If you satisfy the requirements for RMI, like a registered medical practitioner, then safe locking capacity, then infrastructure and personnel to maintain records. Those are the things which are needed to get RMI status. No need of pharmacy license.
Thank you, sir. So one doctor has posted that she is working in a PHC. So what is the procedure to procure opioids in that PHC so as to be used for a palliative care?
So where is she from?
I'll have to check.
She's from Kerala.
Probably from Kerala.
Yeah, that's where PHC. It's only in Kerala that we have reached to the level of PHCs procuring morphine. Nowhere else.
Shalini, I think from Goa also many doctors have joined from PHC level, so might be from Goa also. We can check on that.
Sunanda, we could not hear you properly.
So
I'm
she said to
saying
check
that-
on,
Yeah, I'm saying that there are doctors who have joined from PHC level from Goa, so
Okay.
we can also check that. Yeah.
Okay. So maybe I think it would be better whoever has this doubt, you have to get in touch with the facilitators here, regional facilitators. They would help you. Actually, if you are from the government sector, you need not apply for RMI status, and you can directly apply to the dealer from whom you are going to get the ENDs. But I think it would be helpful if you get in touch with our regional facilitators. They would help you.
Thank you, sir. Most of the other questions that were posted by the participants has been already dealt in this whole session. So many of them had posted how to apply for a license. So that's the whole thing that we were talking about. So some specific questions were there, and that's what I had read about right now. So yes. So if there are no more questions, so I would like to inform that there will be a learning material that we'll be sharing from our end, where all these details will be there regarding the forms, regarding the annexures that Dr. Sunil and Shalini ma'am had spoken about.
If this is the last session, please also.
So we would like to hear your feedbacks regarding this session as well as for the whole program, as this is the last session for this batch. I hope you all had a wonderful time and a happy learning throughout this program. So we invite you all to, unmute and talk about, give your feedbacks regarding this program. So that I think that will motivate us a lot, and also it will help us in changing new things in the upcoming batch. So your inputs are definitely needed for us. So I would request the participants to, unmute and speak now. And you can post in the chat box also.
I will take your leave. I need to rush for another session. Thank you. Thank you for the time to listen to us. All the best to everyone.
राजमेर साइड हो गया क्या?
Anybody would like to unmute and speak, Dr. Upakul?
Hello, can I speak? Dr. Dilip Paul here.
Yes, Dr. Dilip. Please go ahead.
Thank you all. It was a wonderful learning, though myself being an oncologist, and I had been doing a lot of work in preventive oncology, but my passion is now shifted for palliative medicine, and I'm intending to do a lot of work. So got a very good insight from all the lectures. My second question was, thank you for the entire team. My second question was, suppose in between, if we need assistance, maybe for setup of the clinic and permission, I know there's a regional center where I can coordinate, or if I want to visit the Trivandrum Center and spend few days and learn more things. So whom should we contact?
Yes, so definitely. So if you want to get any advice on how to procure a license and all of it, you can reach out to the regional facilitators. And for the training, you can write to education@palliumindia.org. If you would like to come on site and visit our center, would like to learn about how we do home care, IP, and everything, we definitely invite you, Dr. Dilip, to come forward and visit our center. So you can write to this mail ID. Gayatri, can you please post the mail ID in the chat box? Education@palliumindia.org, which is handled by our sister Sheba, who's currently handling the training thing. So please write out to her, and we will reach out to you back.
Dr. Farana, can I speak to
Yes,
Dr.
yes,
Dilip?
Sunanda. Please go ahead.
Dr. Dilip, this is Sunanda. I work for Pallium India for the state of Maharashtra. So are you from Maharashtra? Dr. Dilip?
Dr. Dilip, are you there?
He's there, but he's not audible. Dr. Dilip Pawar, sir, are you there, sir? Can you listen? He's not audible.
Can you hear me?
Yes,
Yes,
sir.
Hello,
Yes,
Dr.
sir.
Dilip, go ahead.
You're from which part?
Yeah.
Like, are you from Maharashtra
Yeah.
or Goa?
So I'm from Maharashtra. I'm from Mumbai.
Okay. So I'm the
So
contact person, sir. So I'll help you with the new palliative care center and what are your queries.
yeah.
So
So
I
I'll
think
definitely call
sure.
you for that help.
Yes.
And maybe our some more plans are there which I can offline discuss. And
Sure,
definitely
sure.
I'll before that for a week or so I want to visit Trivandrum. So
Yes,
offline
yes.
I'll connect.
Yes, I'll help you with the visits also. So my email ID and phone number is already given in the chat box. So for Goa participants also, I want to just tell that I am the contact person for Goa as well. And if there is anyone from Orissa, so I'm looking after these 3 states. Thank you. Thank you all.
Thank you, Sunanda ma'am, for that. So anything else that you would like to share regarding the sessions and everything, please feel free
Yeah,
to
sorry.
open.
One more question I had. I actually posted in the chat box. Now you list these centers on the website. So is there a formal approval to you take from these centers to post their name as the palliative centers in the country?
Yeah, I would like to answer that.
Yeah.
So what happens is that when a particular center is, maybe it's a new center, for example. So once the center is set up, we talk to the concerned doctor and we have a form. So we send them by email and ask them to send the details. Like the form asks you for the name of the center, the facilities, is it chargeable or free? Like, is the doctor trained? Do you have morphine? These kind of basic information. So once we get a reply through email from that particular center, the concerned doctor, so then with their consent, we put it definitely. And second part is some centers are already there, and we somehow got in touch with them. I mean, we have not facilitated, but we came to know that it is already existing in a particular state. So again, the same procedure, we contact them and then we write to them that we have come to know and we would like to, post or upload your details on our website. So again, there's an email and then they give their consent, they fill the form and then with their consent, we upload it. So that's the procedure.
Thank you, Sunila ma'am, for adding that. And so I request all of you to make use of the telehealth platform also. It is not only for patients and families with serious health related suffering. We launched it in 2021 to help healthcare professionals all over India to reach out to us if they have any difficulty or challenging situations in managing their own patients. So if you have any doubts regarding a patient, like if you want to discuss your patient story and take suggestions from our end, definitely we are there to support you with the pain relief as well as the palliative care. Whatever doubts you have, you can reach out to our telehealth. The lines are open from morning 9:30 to evening 4 o'clock on Monday to Saturday. So it's run from Monday to Saturday, and we have a dedicated telehealth doctor and a telehealth nurse as well as a social officer working with the Department of Telehealth who will be there to support you. So please make use of that opportunity. It is free and you can always reach out to them and clear your doubts, because now you have learned anything. When you start practicing, definitely you will be having a lot of difficult situations, like how to start, what to start, how much morphine I'm going to write. So all these challenges will actually prevent you, or it will be like a barrier for you to write that prescription. So you should get that confidence, definitely, for those who have not used oral morphine or not used to palliative care previously. So don't have that hesitation at all. We are always there here to support you. So please feel free to reach out to us. So I request this to all the participants of this batch. And also regarding this session, we have a post-session evaluation form which will be shared in the WhatsApp group right now. So we want all of you to answer the questions in that evaluation form. It is just to check your knowledge as well as confidence level after the completion of this session on opioid availability. It is not taken into consideration for the eligibility criteria or your certification. So it is just a Google form. So you can just open it and post your answers there. So it will help us to know how this has actually improved your knowledge and confidence levels. So thank you so much. And I hope you all had a great time, and I think I also had this batch was really very close to me. Most of the participants had reached out to me for something at least, and also to Gayatri. I think this was the first time I'm working with Gayatri, and I had a very good support from the virtual coordinator Gayatri. So I'd like to thank the whole team, the education and skill building team, as well as Gayatri for being a support throughout. Thank you.
I had a question.
Yes.
Can we open the iEco app whenever we want, or is there some time validity for us? Like each batch has certain time, because the slideshows and all the presentations, especially the all the important notes and all are on that presentations, no? So we don't have it with us personally. So do we need to download it personally for us, or can we, whenever we need to refer it, we can just open and check it out, or is it there is some time frame for it?
Gayatri, please answer.
No, there is no time frame for it. You can download it and you can use it for the further purposes.
So the ICO app we can open anytime we want.
Yeah. Anytime you want, doctor, but then I would suggest that you download these learning materials and keep a copy of it in your, laptop or anywhere in your drive, because sometimes even if you miss those information, you will have it already in your drive. So it will be there to help you out even if you have any problems later. So the access is there, but still we suggest all participants to download and save a copy of it in your laptop or drive. I think that
Thank
helps. Thank you. Thank you. Thank you, everyone. And I think we can close the session for today.
No? Thank
Yes,
you.
Dr. Kurt.
Thank you all.
Thank you so much.
Thank you. Thank you, Sunanda ma'am, for joining us. Thank you.
I said no.
Yeah. Take care of.
Thank you, everybody. Bye bye.